Thank you for that forecast, Devin. Always appreciate it. But an edema affects many people and can cause pain and make it difficult to move around. And here to tell us more about what an edema is and what to watch for is Nurse Christina Paris.
Hi, good morning. It's actually edema.
Edema.
But it does look like that. It can be easily, mispronounced or misconstrued.
An edema.
Edema. Yeah.
Well, hot dang. Well, all right. So we learned how to say it. Let's get into a little bit more of what is an edema.
Absolutely. Well, you are kind of young, so that's why you probably aren't as aware of edema. But it's something that occurs. It can occur at any age, but mostly to people who are older or pregnant. And what it is basically is fluid accumulation in different parts of your body. Typically, we see it in the lower extremities, but it can occur anywhere, around organs, in your lungs, in your brain. You can get swelling anywhere. If you had a head injury, for example, you could get edema there, and it would be like cranial edema. You can get swelling or edema or fluid collection around your lungs. We call that pulmonary edema. Or you can get it around your eyes. So people who are diabetic have diabetic retinopathy. That is a kind of a worsening effect, is swelling around there. We call that ocular edema. And then people who have heart issues or problems with circulation, we call that peripheral edema, and that's where your hands or your lower extremities or legs will start swelling. So what happens is the fluid that circulates through the body can go into that tissue around the blood vessels. And we call that's interstitial tissue. And so that accumulation, and the reason it goes to the legs is because of gravity. So it can pull down.
I was going to say, because you do notice that some people have, sometimes it does look like there's some swelling in the legs or ankles in areas like that.
Yeah, absolutely. And sometimes you'll see a discoloration. So their legs we call that hemosiderin staining. So the accumulation can be there for so long, their legs will look purple or dark in color to the lower extremities. Your skin can also get really tight and leathery just from the damage to that tissue, and can be kind of tough. The skin can get tough from long term. Yeah.
So that's probably part of the symptoms, but what other symptoms should we be looking out for?
Yeah, so you're right. You're going to have some swelling. You're also going to see puffiness, maybe feel like your legs are really heavy or difficult to walk. You might see, like we talked about, the discoloration. It might look bruised or purple. Typically, we see that in like the calves, around your calves or lower legs.
On the farm.
Yes, not those calves. The calves. And the skin will feel kind of tight or warm. Sometimes you'll have pitting. That's where you take your finger, maybe stick it or push it in on the skin, and the skin will stay indented.
Interesting.
So that's called pitting edema. Your legs will just, be swollen. It can be hard to walk. You're going to watch your weight. So people who we know have congestive heart failure, we're going to watch their weight daily. And that way we know how much fluid is accumulating or if it's becoming dangerous, depending on that. People will have difficulty breathing too if they have edema around their lungs. Of course, you're gonna can't take a deep breath in.
There's some real obvious signs to look out for, so people can really be paying attention to this.
Absolutely, absolutely. And and some people even travel. I know you travel a lot. You can get swelling from that too. So if you sit for long periods of time, like in overseas travel, and not getting up enough and moving around, you can get that edema there as well.
It's always just so awkward. I like the window seat, so I never like to bother the people next to me when I got to get up and use the restroom. So you try to power through.
Yeah, but it's not good. You got to move or stand up and stretch.
So what are some things that, that people can do for treatment-wise?
Yeah, absolutely. So the first thing is to find the root cause. So you're going to want to go to your doctor, have that conversation, let them know, look, I'm concerned about this. I'm feeling short of breath. I'm having visual, problems with my vision. Maybe you're feeling dizzy because of your head if there's swelling there. So you're going to want to go talk to your doctor. They can do blood tests, they can do x-rays, and find the underlying cause and treating that. Now, if you just have peripheral edema, say you were on a long trip or you're pregnant or you know you have congestive heart failure, some things you can do is limit your salt intake because the salt will pull the fluid into that interstitial tissue. So you want to reduce your salt intake. You want to watch medications. Some medications can cause edema too. So to have that conversation, maybe it's a medication they can switch, like a diabetic medication that's causing edema. They can switch you to something different. There's lots of options out there right now. You want to wear compression stockings. So those can be ordered, medical grade compression stockings from your provider. They add that compression to sort of keep the vessels kind of upright. If you think of a straw from getting squiggly, you want it, make easier for the fluid to move around. And elevating your legs. So just by pure elevation, keeping your legs almost at heart level. So maybe laying down on a couch like this and putting pillows, your legs up on a pillow, will help bring that fluid out of your legs and reduce the swelling.
Oh, good tips, and of course, probably always good to talk to your provider.
Absolutely. Anytime you have these kind of symptoms or you're concerned, go in and have that conversation, because finding the root cause is really what's going to be key to getting proper treatment.
Well, fantastic. Thanks for coming on in this morning and tell us a little bit more about edema.
Yes.
There we go, edema. All right, well, thanks again. So, coming up though this morning, we have some trending